Antibiotic resistance happens when bacteria change to protect themselves from an antibiotic. They are then no longer sensitive to that antibiotic. When this happens, antibiotics that previously would have killed the bacteria or stopped them from multiplying no longer work. Infections caused by resistant microorganisms often fail to respond to the standard treatment, resulting in prolonged illness, higher healthcare expenditures, and a greater risk of death. Many standard medical procedures will turn into very high-risk procedures. So you may be asking, why is antimicrobial resistance a global concern? It's a global concern because new resistance mechanisms emerge and spread globally, threatening our ability to treat common infectious diseases, resulting in death and disability of individuals who until recently could continue a normal course of life. Each year in the United States, at least 2 million people become infected with bacteria that are resistant to antibiotics, and at least 23,000 people die each year as a direct result of these infections. Many things cause antibiotic resistance, but the most common is using antibiotics when they are not needed and not taking antibiotics at the doses and times that a doctor prescribes. If you develop antibiotic resistance, you will have the infection for longer. You also may be more likely to have the complications of the infection, and you could remain infectious for longer and pass your infection to other people, which increases the problem. So you may be asking, how do these antibiotics work? Antibiotics differ in the type of bacteria they work against. The 5 different mechanisms of actions are cell wall biosynthesis, nucleic acid metabolism and repair, protein synthesis, alteration of cell membranes, and antimetabolite activity. The most common mode of action for antibiotics is the inhibition of cell wall synthesis. Antibiotics that inhibit cell wall synthesis work because of the fact that most eubacteria have peptidoglycan-based cell walls, but mammals do not. Growth is prevented by inhibiting peptidoglycan synthesis. Thus, these antibiotics only work for actively growing bacteria. The cell wall of new bacteria that grew in the presence of cell wall synthesis inhibitors is deprived of peptidoglycan. These bacteria will be subject to osmotic lysis. An example of how resistance can occur is when the antibiotic fails to cross the membrane or when the bacterium is intrinsically resistant. Inhibition of nucleic acid synthesis inhibits synthesis of essential metabolites required for the synthesis of nucleic acid. For example, rifamycin inhibits RNA synthesis, and resistance comes about when the beta subunit of RNA polymerase is altered. Antibiotics that inhibit protein synthesis work because of the fact that the bacterial ribosome and the eukaryotic ribosome differ structurally. Preventing protein synthesis does not necessarily kill the bacteria, it prevents growth. Commonly, these antibiotics are referred to as bacteriostatic. An example is aminoglycosides, which irreversibly bind to 30S ribosome proteins. Resistance occurs when there is a mutation of the ribosome binding site, decreased uptake, or enzymatic modification of the antibiotic. Antibiotics that injure bacterial plasma membranes lead to cell death through leakage of cell contents and associated disruption of the cross-membrane potential. An example includes polymyxins, which have cationic detergent-like activity, but resistance occurs when there is an inability to penetrate the outer membrane. Antimetabolites are chemicals that inhibit the use of a metabolite. There are also antimetabolites that are specific for the metabolism of certain bacteria, hence making them suitable to use as an antibiotic. An example includes trimethoprim, which inhibits dihydrofolate reductase, preventing the synthesis of folic acid. But resistance can occur when there is a decreased affinity of dihydrofolate reductase. As a result of the increase in drug resistance, a great number of superbugs are now being produced. Superbugs are strains of bacteria that are resistant to several types of antibiotics. With Australia ranked 7th in the world for the most use of antibiotics, superbugs are a very real problem, and there is no known antibiotic to cure them. NDM1 is one of the biggest threats to antibiotics. It's an enzyme which gives bacteria the genetic ability to become resistant to antibiotics. Imagine placing a red t-shirt in a washing machine full of white t-shirts. The end result is going to be that all the white t-shirts are going to turn red, and that's exactly what NDM1 does. It converts all the healthy bacteria into superbugs. Multi-resistant TB is another superbug on the rise and is present on the doorstep of Australia in Papua New Guinea. With TB being an airborne disease and now having the superbug strain formed, a once well-managed disease is now more life-threatening than ever. And with antibiotics now resistant to these superbugs, the number of deaths is on the rise. In order to manage the problem of antibiotic resistance, doctors and patients in developing countries need to be well educated. In many countries, antibiotics are available without a prescription. Make sure you consult a doctor before taking any antibiotics. If you're not feeling well, make sure you stay at home to prevent the spreading of germs. Wash your hands and remain clean at all times. And remember, antibiotics don't just kill harmful bacteria, but also kill bacteria your body needs. So if you don't need them, don't take them.